So for the CVC dressing, I will first put my gloves on, my mask on. I'll do my hand hygiene. And then for in a hospital setting, I would have 3 flushes for the 3 lumens. But for this test out, I'll be using just 1 lumen, and so I need just 1 flush. So I'll open up my flush and prep it. I'll go in the trash. Okay. And then I would scrub my hub for 15 seconds. I feel like I should have gloves on, so I'll just go ahead and put my gloves on. And then scrub for 15 seconds. So I would say 15 seconds is up. It goes in the trash, and then I'll flush. So I'd look this in. Pull back to aspirate to make sure it's still in the vein, and then I'd flush the whole 10 mils in. This would go in my sharps container. Okay, I'll take my gloves off. Goes in the trash, and then I would inspect the site, make sure there's no redness, or check for redness, swelling. I'll then palpate, checking for warmth, and as I palpate, I'll check my patient to see if he's responding or indicating he's in any kind of pain, but he looks okay, and so I can then go ahead with the procedure. So first I would open up my sterile packages using sterile technique. So this had already been opened, but in a real setting, it would be a brand new one. I'd still open it up using sterile technique all the way back and away from myself, and it's just fine as that folds away. And this also has been pre-opened, but I get a new one in a real setting, and also open this up using sterile technique away from myself. Okay, there are my gloves. And now I take off the old tegaderm, moving it towards the center of the insertion site. And I don't need my gloves for this because I'm just pulling the tape up and staying away from the insertion site. So when that's all loosened up, I can then go ahead and put my clean gloves on. Just scrub my hands again. Okay, now touching the outside of the dressing, I'd leave the dressing up. And then I'll inspect for any type, amount, and color of any discharge. And I'll make sure to document this. And this would go in my biohazard container. And then the site itself, I'll check for any inflammation, if there's any pus, if there's any drainage, everything looks good. And then in a real patient too, there'll be sutures here and here. And I'll take a look at those sutures and make sure there's no skin growing over them. Everything looks good, there's no redness. and then I can proceed. So the first thing I'm going to do is take my gloves on and then put my sterile gloves on. Now I'm going to trash too. Move this a little bit this way. Okay, first I'll put my non-dominant glove on, or the glove on my non-dominant hand on first. I'll grab it by this and step back. Then I'll grab underneath the cuff. Okay, just put this in the trash. And then next thing I do is to pick up my ChloroPrep, then I'll activate it away from me and my patient. Okay, and then for this kind of dressing, you'd want to do scrub or friction in a box-like fashion. So I'd go here, 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 and then I'd have to pick this up to wipe underneath it. And then have to do this for 30 seconds. Let's scrub there, I'll scrub here, scrub here. So this should go on for 30 seconds. And then just because there's this tape here, I'd use my pinky and see how much I can lift this up so I can scrub underneath it. Scrub underneath it. Well, in a real patient, there'll be sutures holding this down, but we'll just do the best we can and scrub for 30 seconds. So I'd say 30 seconds is up, and then I'll let this dry, and then this will go in my trash. So when this is dry, we'll just assume it's dry. I would then grab my gauze, and I'll place it in such a way that it's not really close to the tip right here where the sutures are, so my tegaderm can fit. So I place it somewhere there, so then my tegaderm can go over there. And then I'll grab my tegaderm. Careful not to touch anything else with these two fingers that contaminated when lifting this up. So this crease will go right over here, so we can mold the skin down. And this isn't sticking on very well just because this is a mannequin. Oh, I think I'm doing something wrong. I forgot to take the tape back here off. So it's still not really dry, but it should stick on, right? But we'll just pretend it's stuck on real good. And in a real patient, in a real setting, I would probably get a new tegaderm, because this isn't sticking on very well just because it's still wet. But I'm assuming in a real patient it'll be all dry and stuck on better. So the Tegaderm should actually hold this down here if it's dried, and on a real patient it should stick down there. And then I'll take this out. So the sterile procedure is done now, so I can take my sterile gloves off. This will go in the trash. I'm gonna initial this, my name, initial and time. I can just stick this down here. Okay, and then just so this doesn't move around, I could take this tape off and apply a new tape just so it stays down. Okay, then I'll make sure my patient is comfortable. The procedure is over. I'll go document everything I did, what lumen I used, and make sure everything is well documented.